Why healthcare CX needs Agentic CX plus a completion and compliance layer. Healthcare leaders increasingly believe they have automated customer experience. Chatbots answer questions. AI agents triage requests. Digital front doors look modern. But underneath, something dangerous is happening. Healthcare CX has automated conversation while quietly leaving execution unfinished, ungoverned, and non-compliant. The result is a growing gap between what patients are told and what actually gets completed inside regulated systems. That gap is now one of the biggest hidden risks in healthcare operations. Conversation is not completion. Chatbots are good at understanding intent and responding in natural language. That is useful, but it is not the hard part of healthcare CX. Healthcare is defined by irreversible actions, authorizing care, refilling prescriptions, capturing consent, updating records, handling billing and payments, exchanging protected health information. These are not conversations, they are executions. Take a few everyday examples. A patient requests a prescription refill. The chatbot confirms the request, but the actual work requires insurance verification, formulary checks, physician approval, pharmacy routing, and confirmation that the order was successfully transmitted. Somewhere along that chain, the automation usually stops and a human takes over. A patient starts a prior authorization. The AI collects context, maybe uploads a document, and reassures the patient. But submission, tracking, escalation, and final approval still happen through disconnected systems, emails, and manual workflows. A new patient is onboarded. Information is gathered conversationally, but consent, disclosures, and identity verification often fall back to PDFs, portals, or agent follow-up. From the outside, this looks automated. Internally, it is not. Healthcare CX today is optimized for talking, not finishing. The false sense of automation. This is the moment most organizations miss. They measure chatbot success by containment, deflection, or CSAT. Meanwhile, completion still relies on agents, spreadsheets, portals, and manual re-entry. The system feels modern but behaves like legacy operations with a conversational wrapper. This creates three compounding problems: operational drag, because humans are still doing the last mile; patient frustration, because journeys stall or repeat; regulatory exposure, because execution is inconsistent and poorly governed. The more agentic the front end becomes, the more dangerous this gap gets. Because now AI is not just answering questions, it is initiating regulated actions, and that leads directly to the compliance problem. When likely correct becomes a liability. Healthcare operates under zero-tolerance rules for error. HIPAA, high-tech, PCI DSS, consent laws, and audit requirements do not accept probably correct. Generative systems are probabilistic by design. They produce the most likely response, not a guaranteed one. That is fine for conversation. It is unacceptable for execution. Here is where risk quietly enters the system. A disclosure shown too early or too late. Consent captured conversationally but not audit valid. PH. I entered in a channel that breaks chain of custody. A billing explanation that is accurate in tone but wrong in fact. A workflow that skips a mandatory step because the model inferred intent. None of these failures look dramatic in real time. They surface months later during audits, disputes, or legal reviews. At that point, logs are incomplete, steps are unverifiable, and accountability is unclear. Healthcare organizations are discovering that Agentic CX without deterministic execution creates regulatory debt they cannot see until it is too late. Why Agentic CX alone is not enough? Agentic CX is a real step forward. Systems that understand intent and coordinate actions are more powerful than simple chatbots. But agents are decision-makers, not executors. They decide what should happen. They should not be trusted to guarantee how it happens in regulated environments. What healthcare actually needs is a separation of concerns. AI to interpret intent and guide experience, a dedicated completion and compliance layer to execute safely. This is the missing architecture in most healthcare CX stacks today. The completion and compliance layer. A completion and compliance layer sits between AI and systems of record. It is not conversational, it is deterministic. Its job is to guarantee outcomes under regulatory constraints. That means enforcing step-by-step execution with no skipped actions, controlling exactly when disclosures and consents occur, capturing sensitive data through governed micro-apps, not open chat, validating inputs before they touch core systems, integrating directly with EHRs, billing, and payer systems, producing immutable, audit-ready execution trails. AI can decide that a patient wants to refill a prescription or dispute a bill. The completion layer ensures that the refill actually happens correctly, legally, and provably. This is the difference between automation that feels good and automation that holds up under scrutiny. The real problem healthcare leaders must confront. Most healthcare organizations already have Agentic CX in production or on the roadmap. Very few have asked the harder question: how do we guarantee completion, compliance, and auditability once AI initiates action? Until that question is answered, healthcare CX remains structurally incomplete. The future of healthcare CX is not better chatbots. It is not even smarter agents. It is agentic experiences backed by a purpose-built completion and compliance layer that finishes what AI starts and makes regulated automation safe at scale. That is the shift healthcare CX must make next.